Max Wardell here, overheadathletics.com, and we're talking about sleeping position after shoulder surgery. Hey, welcome back to the channel, guys. Today we're talking about sleeping position after shoulder surgery. We're actually here for a night stay at the APTA, American Physical Therapy Association, Michigan Spring Conference. I'm going to be presenting tomorrow on rehabilitation techniques and biomechanics of throwing. And I thought this was a great time to kind of showcase how we should be kind of thinking about sleeping and pain with sleeping after shoulder surgery. One of the biggest complaints that we get in physical therapy and in the medical world is, I had shoulder surgery, I can't sleep, it hurts to sleep. And one thing we like to do is have people sit in a recliner chair because the way that gravity affects the shoulder. But once I start to get in bed and lay down, a lot of times that's when pain will come about after a shoulder surgery. So thinking about a few things here, number one is always position of the shoulder. So whether you're laying down or in the recliner, if you're not wanting to wear your sling and kind of get chafed on the neck, pillow is a great option. Now the pillow's not a great option if you like to roll, toss, and spin in bed, but if you're kind of just nice and relaxed, you don't move around too much, the pillow is a great alternative to the sling, which can sometimes be uncomfortable. And the way we like to position a pillow is under the arm. So you slide it in, tuck it up into the armpit as much as you can, and now you can see that this pillow is kind of keeping me into that same position as those supportive slings do. And I can sleep in this position, but a lot of times people say, as soon as I lay down, I have pain. Why is that? Number one, positioning. A lot of times people let their arm fall down into extension this way too far, and that's a big problem after rotator cuff repair, after a labral repair, whereas this pillow can kind of prop you up and keep you in a good position. Positioning is important, but also forces. The force vector of gravity here, gravity is pulling down or pushing down from an anterior, so front to back view, and that puts a load on the shoulder back into the socket and sometimes up a little bit because my arm is propped up, so it's driving my shoulder back and down. That can pinch and cause some pain in the top of the socket, especially because all of those tissues just underwent major trauma with surgery. So one thing we think about with the chair is that you sit upright, and as you sit upright, gravity is now pulling down, so it's slightly distracting the shoulder when you're more vertical. And that's why we like the recliner, and that's why people are much more comfortable upright. And as we go back onto our backs, all of a sudden gravity is now pulling on a different force vector, and it's giving us some pain in the shoulder. So we got position, we got the angle of force, but we also have cytokine storm. We have inflammation in the tissues that becomes worse as we become sedentary. So cytokines are inflammatory molecules. There's basically a big inflammatory cascade that's occurring because we had major trauma and injury here. That inflammatory cascade is acidic. It has a relatively low pH, which is aggravating to the type C nociceptive fibers, the pain fibers in the shoulder that are most provoked by chronic wear and tear, chronic physical types of either compression or traction, but also chemical imbalance, so low pH or acidity. That can aggravate those fibers, and those fibers are responsible for achiness. The number one thing we get after surgery is complaints of achiness when I lay down and I'm not moving. So the best thing you can do is get some light activity. We do our pendulums, and you got to make sure you're doing your pendulums properly, which means passively. So pendulums or Codman style exercises, things where we're starting to do some grip of the hand. Pumping blood into the area can start to flush out and restore some normalcy to the pH in the area by getting new blood in the area. So working the hand and wrist prior to bed. Throwing a hot pack on the shoulder to get some blood into the area before we go to bed, and then using EMS, electrical muscle stimulation, or NMES, neuromuscular electrical stimulation, to pump some of those muscles very lightly in the area to get blood into the area and flush out some of those acidic and inflammatory molecules that are sitting stagnant in the shoulder. Think position, the angle of gravity, and then also think get as much blood in the area and pump as many of those inflammatory molecules out of the area as soon as possible. And that's not ice, which is going to cause vasoconstriction. That's heat, especially after 3-4 days out of surgery. Heating the tissue, getting blood in the area with activity. Make sure your positioning is up and slightly out in front of you, slightly popped up at the wrist, and now I'm in a good position to actually get some good quality rest. The other thing is make sure I'm getting my activity in during the day so that I build up enough workload and fatigue throughout the day so I'm tired enough to fall asleep. Those are some things to try and to think about if you just had shoulder surgery.